Patella tendonitis getting you down, keeping you from your workouts or things that you love doing? Well, you're in the right spot. I'm Dr. Brian, this is Movement is Mandatory, and in today's video, we're gonna go through a sequence of movements that are gonna really help you eliminate that pain or stiffness that's occurring in front of the knee. All we're gonna need today is a foam roller in your body weight, so let's get ready to move. Today's video is going to be all about how to create that better activation through your hips, and we're going to also help get that stress away from those quad muscles and also those adductor muscles. So we're going to do two different foam roller techniques, and then we're going to do an activation drill that I really like that helps get that stress back to your hips where it's supposed to be. That is one of the main reasons why we do have patella tendonitis in the first place. But before we go through that, please take a second to like our video, subscribe to our channel, hit that notification button so that we can get you guys the great content that we're putting out on a daily basis. So the first thing we're gonna do is we're gonna get into our quads. Now, I've seen this a lot in the clinic. People wanna get right into that IT band. I will tell you right now, stop doing it. It's not gonna do anything. We wanna get more into those front muscles, all those quad muscles. Your front, you have 4 of them. And the more we can get into that tissue, the more it's going to help release that tension that's occurring from the patella tendon, which is where patella tendonitis occurs because you're overusing these. So what we're going to do is we're going to get, we're not going to just roll. We're going to do what I call a pin and stretch technique. So actually, to show you guys this way. So my foam roller is a little bit longer. Now, if you look at the bottom of our video in the description, we do have a link to a roller that we like. But any roller that you have will work. You're only gonna need the roller on one leg at a time. So what we're gonna do is we're gonna do left leg first. Now, even if you have just patella tendonitis on one side, you still wanna do both. You have 2 legs, you don't wanna walk in circles by just doing one side all the time, and the issue may be coming from the other side anyways. So what we're gonna do is we're gonna hit 3 spots. We're gonna go high, middle, low on each side. And we're gonna do 5 kicks at each. So what I'm doing is I'm getting as much of my body weight into that roller as I can. And then once I find a nice tender spot high up, I'm gonna kick my knee 5 times. And I'm just trying to go through that range at a good comfortable pace. Doesn't have to be super fast or super slow. So to see it from the side, so we started here. Now, we're going to get to about that middle of the quad. That middle and lower are typically more tender than the top. But I'm really trying to get into that tissue. Do one more. Try to get through as much range as I can. So now I'm going to get to right above the knee. And same thing. This is going to help turn off that quad tissue, take some stress off that patella tendon that attaches to it. 2 more. And then we switch to the other side. Same thing, show you from the front. Just getting into that higher hip area. 5 kicks. And then we'll get into the middle. 5 more kicks. This doesn't have to be an exact science. As long as you find a spot that's tender, you're in the right spot. So it doesn't have to be a super specific spot on that quad. In most cases, it's not going to be hard to find a spot that is uncomfortable to go through. Then after that, get above the knee. Same thing. 3 more kicks. And then we're going to get through your adductors. Now your adductors are your inner thigh muscles right through here. So to do this, and we'll go back to the left, what we're going to do is you're going to set up that roller at a 45 to that adductor. We're going to start high up towards the groin. So all I'm doing from here is now I'm just kicking my foot out again
but I'm working more of that inner thigh tissue. I'm trying to keep my foot parallel to the ground as I do this, which is going to help relax that muscle more. This pin and stretch I prefer over rolling in itself, because when you do this, and you pin that tissue down, you can actually get more relaxation of the muscles because there's more pressure involved. Do one more. And now that last spot, right by the knee, is where it's going to be real tender. So we're also getting a little bit of that medial quad tissue too. 2 more. And then we switch over to the other side. Same thing. Higher up in that thigh. Keeping that foot parallel to the ground. 5 of these kicks. Get to the middle. Same thing, just 5 kicks. Putting as much pressure as you can tolerate on that roller, and then right by that knee. Just trying to get as much pressure as you can handle, get through as much range of motion, 2 more reps as you can. Perfect. So now that we've gotten through all that tissue, we're going to go ahead and stand back up. Now things are a little bit more relaxed. What we want to do is we want to get that activation back to the hips. And this is where we're going to do a single leg deadlift, or a modified single leg deadlift. So all I'm going to do is I'm going to set up with my weight on my front foot, but my back toe stays down. And for a minute, all we're going to do is drive our right hand down towards our left pinky toe, but we're only going to go to mid-shin. So what I'm trying to do is load all that weight into this back pocket area, and I use that tension that I've created to drive my hips up and forward. And we have about a minute of this. Oh, see, that's where we keep the back foot down so that we don't make this a balance exercise. We make this an activation and strength. We want to strengthen this hip, and we want to keep that weight towards the inside of that foot. So you see it from this side. I'm not rolling. That knee tracks and stays in that same, my leg stays in that same position the whole time. And I'm really focused on keeping that big toe down as I go through this motion. And I just use that right toe to help as needed for balance. There's barely any weight on it. It's only there when needed. We're going to do 5 more reps, really trying to burn out that hip. You shouldn't feel anything in the knee. You shouldn't feel anything in the quad, because I'm not bending the knee at all. I'm just driving hips back, hips forward, hips back, hips forward. And then we're going to do the same thing on the other side. The weight stays on the inside. That right foot, big toe down. Drive left hand towards pinky toe. Hips back, hips forward. So all that weight stays right in that right back pocket. I have all that tension here, drive it forward. And I keep my hand here just so I can tell my brain, hey, this is what should be firing. This is where I should feel that stress as I go through this motion. And I'm really, as I come back up, pushing down through the inside of that right foot so I can really use that tension and keep that stress away from the knee, which is exactly what we want to do with patella tendonitis. We want to get that stress back to here so that quad doesn't get overworked, which creates all that abnormal tension at the attachment point. We're going to do 2 more reps. Last one. And coming back up. Now, we didn't test your squat at the beginning, but we'll test it now. But just go through that squat, see how that feels in your knees. This should really help alleviate the stress of the patella tendon. We put that stress back to your hips where it's supposed to be, and it's going to really help if you do this process a couple times, and you can rewatch this video to go through
a couple more rounds, it'll really help start changing the way your brain perceives what should be firing. It's gonna take that stress off the quad. It's gonna put that stress back on your hip. So if you guys like this video, please like it, subscribe to our channel. We're putting great stuff out on a daily basis. Tell your friends that are dealing with knee pain, send this video to them. We appreciate you stopping by, watching this video, and as always, make sure to keep movement mandatory.